I retired at 51 after being laid off, and next year, my healthcare costs could change everything. I'm planning to move to an ACA plan, and I still have 13 years before Medicare. I've done the research, and I believe I have the right strategy. But maybe there's something I'm missing. So I'm going to show you exactly what I'm planning to do, what the plan covers, what it will cost me, and how I'm planning to use my income to keep those costs down. This video was actually requested by one of my advisors here on the community, FXDNNY, so shout out to you. If there's a particular topic that you would like me to cover, just let me know in the comments below. So what am I actually planning to do? Well, I'm looking at the HD Blue Extend PPO Silver 2 plan for 2027. One quick disclaimer before we get into this. I'm planning for 2027, but I'm making this video in 2026. So the plan details and costs I'm showing you are based on the information I have available today. Those numbers could change when the 2027 plans are finalized, but this is a strategy I'm planning to use based on what I know right now. So when I started comparing plans, I wasn't looking for the cheapest premium. I wanted to know if something goes wrong, how much would this actually cost me? And that's especially important for a cancer patient. The plan I'm currently looking at has a $750 deductible. And after that deductible is met, I'm looking at no charge for primary care, specialist care, urgent care, emergency room care, outpatient mental health, and generic medications. But there's another number that really caught my attention. The out-of-pocket maximum is also $750. And if you're not familiar with an out-of-pocket maximum, it's basically the most that you would have to pay during the year for covered healthcare services. So I wasn't just asking, what's my monthly premium? I was asking, if I have a really bad year medically, how much am I putting at risk? And that's where this plan looks pretty attractive to me. But there was one thing that I absolutely had to check, my leukemia medication. Because I don't care how good an insurance plan looks on paper, if the medication I need isn't covered. Thankfully, it is. So at this point, I'm thinking, okay, this plan could work. But then I found the part of the plan I don't like nearly as much. For out-of-network care, the plan generally pays 75% of the allowed amount, leaving me responsible for the other 25%. And that's probably the biggest question mark in this entire strategy. Because if I have a serious medical issue and need an out-of-network doctor or facility, my costs could look very different. And that's why I see my HSA as another layer of protection. I currently have close to $60,000 in an HSA specifically for healthcare. But an HSA doesn't make a big out-of-network bill disappear. So that's one of the trade-offs I'm accepting. Now we get to the part that really determines whether this plan works for me. What is this actually going to cost? I like the coverage. I like the $750 deductible. I really like the $750 out-of-pocket maximum. And my medication is covered. But none of that matters if the premium is too expensive. And that's where the ACA subsidy becomes a big part of my strategy. I'm not planning to simply pay the full cost of this plan out of pocket. My goal is to keep my income within the range that allows me to qualify for an ACA premium subsidy. And that's where retirement gets interesting. Because I don't have a traditional paycheck anymore, my income is coming from several different places. I'm estimating about $12,000 a year from rental income. I'm also estimating about $13,000 between my teaching and financial coaching gigs. And I'm estimating another $4,000 from dividends and interest. So my gross income from these sources could be around $29,000. But after the adjustments that affect MAGI, modified adjusted gross income, I'm expecting my MAGI to be around $31,000, and that number matters. Because when you're retired, Earning more money isn't always as simple as more income is better. More income can also affect your ACA costs, and that's why I'm paying close attention to my modified adjusted gross income. The number that I'm watching closely is that 400% of the federal poverty level. For 2026, that's around $63,840 for one person, although the number that will apply when I enroll for 2027 coverage could be different. In my state, I need to make sure my income doesn't fall below the level generally required to qualify for marketplace premium tax credits. For 2026, 100% of the federal poverty level for one person is $15,960. With my rental income of $12,000 per year and $4,000 in dividends and interest, I can easily meet the current minimum requirement. But it also means I need to pay close attention to where my income comes from and how much I actually earn during the year, because I don't want to accidentally create a healthcare problem by making more income than I expected or too little income. And that's the balancing act that I'm dealing with. So how much is the monthly premium for the Blue Extend PPO Silver 2 plan? And how does this affect my monthly budget? Well, my monthly expenses are $2,000, and that includes my $515 mortgage. However, in January 2027, my mortgage will be paid off, so that will free up $515. The monthly premium after subsidies for the medical plan is about $364.39. So in my monthly budget, I'm essentially replacing $515 mortgage payment with a roughly $365 healthcare premium. So here's the bottom line number. $364.39 monthly times 12, that's about $4,373 a year in premiums. And if I also had to pay the full $750 deductible, I would be at about $5,123 for the year before any cost sharing. And this number is actually less than what I pay for commercial healthcare coverage from my former employer. Now, there are some things that I can't control. The ACA rules could change. The subsidy rules could change. Premiums could increase. My healthcare needs could change as well. I'm trying to keep my healthcare costs manageable while still having enough protection if something major happens. And I'm using my HSA as another layer of protection. But I'm not pretending that my plan is risk-free. My rental income can disappear. And if that happened, I would probably have to teach more than the 3 classes I'm planning to teach each year. Another risk is, what happens if this plan becomes much more expensive a few years from now? That's something that I can't control. I can control how much I save. And for the most part, I can control how much income I generate. I can control how I grow my HSA. But I can't control what happens to ACA premiums or the rules around subsidies. So I have to treat this as a strategy that can change, not a decision that I make once and forget about. So that's what I'm planning to do. I'm going to move to an ACA plan next year. I found a plan that I'm comfortable with. My medication is covered, which is important. The deductible and out-of-pocket network maximums are manageable. I'm watching my income because if it can affect my healthcare costs. And I've also got my HSA as another layer of protection. So I feel pretty good about it. But then again, I may be missing something because this is all new to me. If I've missed something in my plan, or you see a way I can make it stronger, let me know in the comments below. I am open to any suggestions or adjustments that will make my plan stronger. I don't think that I've solved healthcare for the next 13 years. I've created a plan for next year, and that's an important distinction because there are a lot of variables and things can change. So I'll have to revisit this every year. Thanks for watching, and I'll see you in the next video.